It's been used for decades as a gesture of love, and guilty pleasures for chocolate may be responsible for insufferable pain amongst migraine sufferers. This is according to a recent study from a headache and migraine medical journal. The London-based study used chocolate bars and bars of carob as placebo. The study, conducted on a sample group of 20 migraine sufferers, showed that chocolate does indeed cause migraines in certain unfortunate patients. We're now joined by Dr. Elliot Shevel, founder and medical director at the Headache Clinic in South Africa. Dr. Shevel, very good to have you back. A very good morning. Now, it is the month of love, and I'm sure very many people got chocolates as gifts, but is it accurate to say that chocolate really does cause a migraine?
Well, in some people, it apparently does. There have been conflicting studies. Some studies have found that it doesn't, and others have found, as you've seen in this one, that it does. But there's one way to really tell, and that is to have what they call a headache diary. In other words, you write down exactly what you eat, when you eat, and when you get your headache. And you can then plot and see if you've had chocolate, that you get a headache in a short while after that. Every time, then you know it's that. And people can get a free headache diary if they just phone into the headache clinic, and then they'll be able to plot it exactly. But chocolate's not the only cause.
I was about to ask, are there other causes?
There are many triggers, but one has to differentiate between what's triggering it off. For instance, in chocolate, there's a chemical called phenylethylamine, which causes dilatation, or rather stretching of the blood vessels. Now, in some people it does that because their blood vessels are different to the normal. But the important thing is that we can actually cure that. One doesn't have to stop eating chocolate if you tackle the underlying cause. Now we can actually do surgery on the blood vessels and eliminate the problem permanently.
But let's talk about a migraine. What is a migraine? What happens in our heads? Why is it so painful?
Well, the first thing one has to understand, it's not inside, it's outside. It's not in the brain. Recent research has proved that 100% sure. So some structure on the outside of the skull is hurting, and we've done research with a number of professors from overseas and at Harvard and other universities, which shows that most of the pain comes from these arteries on the outside. They call them the branches of the external carotid artery. And you said, what is a migraine? It's merely a very, very bad headache where the patient is perhaps nauseous, vomits, is light sensitive, etc. But the good news is that we can usually cure these people. You don't have to suffer anymore.
Well, let's go back to the headache diary, or the migraine diary that you said freely available at the headache clinic.
Yes.
What exactly do you have to jot down? Every single thing you eat, whether it be chocolate or anything else that triggers it?
One can never be sure. First of all, not everybody has those dietary triggers. So it might come out negative, but one can never tell what you're eating that is causing the trigger. So you write down everything. Every time you put something in your mouth, you write it down. And then you write down when you get the headache. And very soon you can plot. But as I said, the nice thing now is that one doesn't have to give up the chocolate or red wine or whatever you like, because we can actually do something about it. We can cure it.
Now, for our viewers watching now, especially the migraine sufferers whose migraines rule their lives, and it can be quite a debilitating thing, what happens out there to make an appointment with the headache clinic?
They just have to phone the number. We've got a national number, which I believe is up on the screen.
It is indeed. It's 086 167 8911.
Yeah. And we have branches in Cape Town and Durban as well as Johannesburg, so it's reasonably easy.
But is it a simple process? Because I'm sure they're anticipating to get a cocktail of medication as is readily available over the counter at pharmacies. Or is it a more in-depth look at exactly what the cause is and, of course, a solution?
That's 100% correct. We don't advocate medication. The rescue medications that people take when they have pain only make the headaches worse. One's got to find the underlying cause, and what we use at the headache clinic is what's called a multidisciplinary approach. We look at it from all angles. There are many different structures in the head and neck. So we have to look at everything to see exactly what structure is causing the pain. And there are two main ones. There's the muscles of the head and neck and the arteries on the outside of the skull. Those are the two main ones, but of course the other structures can also be part of the problem. So one's got to have a look at it from all angles. One can't have one type of doctor, for instance, one specialist looking at it, because it might not be in his field. It might be in somebody else's field. So we look at it from all angles.
All the way down to the root, the cause of the problem. And very quickly, please, Dr. Shevel, I know that there's also something for us to do on the website. And what is the website?
The website is www.headacheclinic.co.za. There is what we call a quality of life test. It's a scientifically accurate test, which takes a few minutes. It's quick, and it tells one how one's quality of life is being affected by the migraine or the severe headaches. And it's interesting to note that they have found that migraine sufferers have a quality of life that is worse than people with rheumatoid arthritis, that have recently had a heart attack, diabetes. It's really, really bad. Their lives are really terribly affected by this. And nobody can see. It's not as if there's something that people can see and be sympathetic with.
That's right, a bandage or something that says you have a migraine. But thank you very much, Dr. Shevel, for coming through this morning and letting us know that not all migraine sufferers have to give up that really yummy chocolate that we also love. Thank you so much for your time.
Thank you.
My search for the bodies